Hi everyone, welcome back. Today we have the privilege of being joined by Dr Barbara Woodhouse, who is one of Australia's leading oral maxillofacial surgeons and on the board of examiners for doctors seeking specialist registration in oral and maxillofacial surgery. She's on the current chair of Operations Interface, and that is an amazing initiative which basically assists with developing countries and their training of surgeons. So again, privilege to have you here.
Thank you.
Today we'll be going through a few questions to again try and help inform us as to what her job entails and different pieces of advice that she has for us. The first question, could you give us a brief overview of what your job entails on a weekly basis?
Okay, so most surgical specialties range from minor procedures to major procedures. So if you're an ENT surgeon, you'll do tonsils, adenoids, grommets,
Yes.
and then you'll proceed to base of skull and neck dissection and half headectomies, whatever. So we have the same thing. So for us, bread and butter is wisdom teeth, or teeth that are too difficult for the dentist to take out, or the patient's too difficult. You do require a medical degree to begin OMS, so you end up probably 50% of the patient cohort is not a surgical problem, but a medical problem that requires oral surgery.
Yep.
Okay, so there's a lot of that. And then at the top end, so this week I've done a parotidectomy, which is removing a big line from here. That is very difficult because it has the facial nerve running through it, so if you make a mistake, the patient ends up with a paralysed face. I have done a facial reconstruction for a lady who had a face that was congenitally twisted towards the left-hand side, so basically her left jaw joint stopped growing, so everything grew towards the right. And the problem then is it's pushed the top jaw growth up as well, so the top jaw is like this. And when you look at someone, you look at their pupils.
Yep.
I'm looking into your eyes, and everything has to be parallel to that.
Yes.
Irrespective of whether your pupils are in fact perpendicular to the rest of your face, it's still, that is our starting point. So I had to start by going inside her mouth and breaking the top jaw off her base of skull and moving the top jaw down until it was parallel to the eyes at the right level. And then I had to go inside her mouth and break her lower jaw on both sides, so I could do the same thing for her bottom teeth so they would meet the top teeth. And she was still twisted towards the left, and so then I had to break off her chin, move it across to the right, and it was pointing downwards, so I had to take a section out so it would go up. I used that bone to plug into the gap that was there on the top left. And all that's done with digital planning, so when the patients had enough orthodontics that the teeth are going to fit together reasonably well when they finish. That's not the end of it, at post-surgical ortho as well. We then take a CT scan, we put that information into a software program which has a grid of the patient, and we then design what needs to be done to make it all square. And sometimes if we've still got a discrepancy, say this is underdeveloped and this is overdeveloped, we will develop a cutting guide to remove some of this, and then we'll mirror what that's going to look like onto the other side, get a subtraction algorithm to formulate what's called a peak implant. So we take some off here and we put an implant on this side to make it even, and that's all done at one time.
Wow, that's amazing.
Yeah, it's all digital planning, and that's happened probably in the last 10 years, and it has transformed what I do. So I did that yesterday, Thursday, and then Friday I was taking out a tooth, so it just
amazing, the contrast.
Yeah,
and obviously, so to get to this position, you were on so much training. How did that whole X amount of years that it took? How do you maintain that motivation and that dedication towards?
You get to a point where you've committed so much into it, it's not really an option to stop.
That's very true.
The big problem is that getting into any surgical training program is competitive. And so we only have about a 30% acceptance rate at any year. So we'd have 30 people apply, but maybe 10 will get in because we're a small specialty, and those 10 will be distributed 2 to each state. 1 to each centre in each state maybe. So it might be 15, but usually it's around about 10. The problem is that to get to that point, you've got to do a medical degree, a dental degree, get your internship in medicine, and then do a surgery in general term. And so by that point, you're committed doing, there's not much else you can do dentistry and medicine with. Okay? It used to be that you would do 5 years dentistry was the best option, and then you work as a dentist while putting yourself through medicine, which is another 4 years, and then you would do PGY 1 and 2, which are your intern years. Second intern year, you get a lot of surgical placements, and then you could apply for training. and that's another 4 years. If you want to subspecialise into head and neck or craniofacial or cleft work or base of skull work, you'd probably do another year or two in the fellowship if you wanted to. You don't have to. These days it's a little bit different. Probably your fastest way it's equally fast, because you would have to do an undergraduate degree for 3 years to get into medicine, which is then 4 years. But then you can do an accelerated course through either University of Adelaide or UQ in dentistry, and then you can work as a doctor while you're doing dentistry, so you can work in the private hospitals for after-hours cover, things like that. And in your final year of dentistry, you apply to get into your 4 years of specialist training. But either way, it works out around about 9 years plus your internship before you start your specialist training. But even then, that's 9, 10, 11 with your internship, and 15, and fellowship is 16. That is still quite shortened by comparison with other surgical training programs. Yeah, it's still a bit shorter.
Which is amazing,
People go, oh, I can't do dentistry as well. But in fact, because we accept from a much earlier level of postgraduate work, it's still comparable.
Yeah, and you were talking about the 30% acceptance rate. Obviously, a part of that, what are the main things that differentiate candidates?
Well, you've always got to have medicine, dentistry and surgery in general. From there on, we're looking at all sorts of things for acceptance. A good research background, although no research, you'll have to do research during your postgrad training, but anything you've done prior will not count towards it. You have to do de novo research in your postgrad training. But a history of research is good, history of community service, a wide experience. So if you've done some rural and some remote work, you've done some worked with specialists, a wide, broad-based experience as possible, and good references that say you've got good hands, because that is the bottom line.
Yeah, of course. Last question, what type of advice, just broadly, would you give to students who are trying to aspire for positions such as that?
If you know that you want to do Max Fac, which I did, because they showed us a video in first day of O week.
Wow.
Of a maxillary osteotomy, which is what I said, breaking the top drawer of the skull. Everybody's quietly vomiting in the corner. I was thinking, wow, that's really cool. So I nearly got sidetracked into dentures, but happily was rescued from it. So I knew from the beginning that I wanted to do it. If you know that you want to do it, I would say go for dentistry, because dentistry is much more flexible to work while you're doing medicine, and that is probably your quickest way of doing it through. If you're not sure and you can get into medicine, if you can get into direct entry like you did, congratulations, that's hard to do, it's very competitive, then that's a good option. Otherwise, you need to do a pre-degree to get into medicine. Same, do dentistry first. It's only an extra 2 years and gives you a good income stream while you're doing medicine.
100%, yeah.
And you lose that 2 years at the top end, because we accept earlier.
Of course. Well, thanks so much for your time. Yeah, that was perfect.
Great. Terrific.
Perfect.